Hi, I'm very happy to share with you the standard of care perio calibration document. We're going to start with our healthy patient. This will be a very easy prophy, uh, pretty much self-explanatory. This patient is going to have probe depths 1 to 3 millimeters. We're going to probe once a year and spot probe on every visit. The treatment recommended is fluoride varnish, sealant, electric toothbrush. This will be applied to all patients. This patient won't show much buildup. Mainly, we will see calculus and plaque around the lower anterior teeth. Moving on to the gingivitis patient. Aside from bleeding and inflammation, this patient will have maximum probe depths or 4 millimeters. There won't be any bone loss noted on this patient, and we're going to probe once a year. The mild gingivitis patient, it's going to have localized light inflammation and bleeding. And this patient, we're going to see them for 4-month recall. The moderate and severe patient, the main distinction here is that this patient has now generalized moderate bleeding and inflammation. So it is extended more throughout the mouth. And for this particular patient, we're going to probe twice a year. That is on the day of the diagnosis and when they come back for the 6-week perio-eval. We're going, instead of a regular prophy, we're going to do D4346, which is scaling in the presence of inflammation. And that will be removal of plaque and calculus, supra and subgingival. Okay, this patient's at the 6-week eval. We will make the distinction between patients that will need 4 to 6 month recall and patients that will come back every 3 to 4 months. And for this, we will use the pocket depths and bleeding points. If the patient has 1 to 3 millimeter pockets, light bleeding, calculus, and plaque, they are going to come in 4 to 6 months. Now, the patients that still present with inflammation, moderate bleeding, plaque, and calculus, these patients are at a greater risk to develop periodontitis. So these patients, we're going to see them more often. It would be on a 3 to 4 month recall basis. For our perio patients, we are going to probe twice a year on the day that we diagnose the disease and when they come back for the evaluation. Now, this patient here is very similar to the moderate and severe gingivitis. The main difference is we're going to see localized radiographic horizontal bone loss. And it is important that we make the patients aware of this. And inform them that they are now they have now progressed into the more complex and aggressive disease that is periodontitis. Okay, so for these patients, it would be the same thing, scaling D4346 and fine scale. For the moderate periodontitis patient, we're going to see 5 millimeter pockets as the maximum. And we're going to notice horizontal bone loss. This patient would come in for SRP. The severe patient will be noticing 6 to 7 millimeter pockets. We may start to see vertical bone loss, localized or generalized. In some cases, we'll see furcation involvement. That is part of, it's possible that we'll see it was severe and most likely with advanced. For these two patients, severe and advanced, when we take regular bite wings, if we're unable to see the bone on the maxillary and mandibular arch, please take vertical bite wings. We are going to treat both patients with SRP. It is important to note that after treatment, if the patient still presents with 7 millimeter pockets or greater, we need to have the conversation. They may need to see a periodontist, and we'll have the discussion with the doctor, and we'll let the patient know, and we'll go into all the details needed. With these two patients here, severe and advanced, it may be that we see these patients interchangeably with the periodontist. So it is good that we have, it is important that we have a good communication with them. Okay, moving forward. Please take x-ray, bite wing x-rays after the SRP is completed. If by any chance there's still radiographic calculus, please address the matter at the next XRP appointment or the 6-week evaluation. There's absolutely no radiographic calculus to be left behind. We have to make sure that it is all fully removed before we move forward with the next recall. Now, after the deep cleaning and the 6-week evaluation, we will schedule the patient for a perio maintenance only. No extra x-rays or exam. And the way we will work with this is we're going to schedule perio maintenance and prophy interchangeably. And so refer to this chart here. After the patient has completed SRP and the patient has been compliant with the 3-month recall, we can reevaluate the perio status and we can make changes. We can then assign a 4-month recall if it applies. Now, it is important to note that after a patient has been diagnosed with periodontal disease, they should not be treated as a healthy patient. In other words, this patient should not be on a 6-month recall. They should remain on a 3 to 4-month recall. And lastly, let's make sure that we change the prophy frequency on open dental. And we can do so under the family tab on the top right corner. Double click on recall and just change it, 3, 4 months or 6 months as needed.